Hi, I'm Dr. Mamtha, practicing obstetrics and gynecology at Forever Women's Clinic for the past 13 years. The topic of discussion today is NIPT, also called as non-invasive prenatal genetic testing. So first thing is, what is NIPT? So NIPT, as the name itself suggests, it's a non-invasive prenatal genetic testing. So the testing is done in it's an early screening of fetal chromosomal abnormalities. Why do we have to screen for the fetal chromosomal abnormalities? Because chromosomal abnormalities, both numeral and structural, are very common. If I have to say the statistics, 0.6%, that is 1 in 150 live births. So as the age of the woman increases, the chances of having an abnormal baby with the genetic abnormalities can increase. So we do NIPT as a screening test to detect the genetic aneuploidies. NIPT is an advanced technique for detecting fetal chromosomal aneuploidies. This technique is based on the analysis of cell-free DNA, that is the blood of the fetus that is present in the maternal blood. So we take the blood of the woman, the mother, expectant mother, and then we try to separate the cell-free DNA, that is the baby's blood cells, and then try to look at the genetic abnormalities in those. Advantages of NIPT screening. NIPT for early detection of fetal chromosomal abnormalities. So we can do it in the first trimester, that is in the first 3 months, and as early as 10 weeks of pregnancy only we can do the NIPT. So we can pick up the abnormal babies or the fetuses very early in pregnancy. The second thing is higher sensitivity and specificity. First thing is, what we have to understand is, it is a screening test and not a confirmatory test. So it has got a very good sensitivity and a specificity detecting fetuses with abnormalities, but any positive value in NIPT requires additional testing for confirmation. According to ACOG, that is American College of Obstetrics and Gynecology, NIPT assays are the most sensitive and specific screening test for the most common chromosomal abnormalities. The advantage of NIPT is to detect the chromosomal abnormalities or the structural and the numerical. The most common chromosomal abnormalities that can be detected with the NIPT are chromosome 13, 18 and 21. Also sex chromosomes, that is Turner's and Klinefelter's. They can also detect autosomal chromosomes microdeletions. So we have two different types in which the basic NIPT detects 13, 18 and 21 and sex chromosomes. The advanced NIPT also detects the other chromosomes microdeletions, and specifically the microdeletions that can be detected by NIPT are Digog syndrome, 1p36 syndrome, Cry-Du-Chat syndrome, Prader-Willi or Engelmann syndrome and Wolff-Fersen syndrome. So the take home point of this thing is, NIPT is done basically as a prenatal test. That is, when the baby is inside the womb of the mother, we try to do the test so that we can pick up the abnormalities early in the pregnancy. So the decision can be taken early. In India, the center that does the NIPT has to be registered in the PCPNDT Act, and we cannot disclose the sex chromosomal abnormalities, that is by the law. And we can do it as early as 10 weeks so that the chances of picking up the abnormalities are very high. Can we do NIPT to all the women? No. There are certain conditions in which we can't offer NIPT to all the pregnant women. Few of them include, if the advanced gestational age, that means that if the lady has crossed her 20 to 24 weeks, which is by far the cutoff limit for the legal termination in India, in such cases, we cannot offer NIPT, because even if a problem is detected, we will not be able to help the couples. And the second thing is, in which the lady has received any blood transfusion in the past 12 months, that will also affect the results of the NIPT. The third category is, if the lady has had any stem cell therapy for some other diseases, that can also interfere with the NIPT values. And if the lady has received any organ transplant. Okay, so these are the conditions in which the accuracy of the test is not good, and we will not be able to tell you for sure if the conceptus has any problem. So we won't advise them NIPT as a testing method in them. NIPT, whom can we offer this test? Or the candidates who are suitable for NIPT are, any woman who is pregnant can be offered NIPT if they do not have the previous conditions that I mentioned. So according to ACOG, every woman should be offered NIPT irrespective of her age and irrespective of her parity. But it is the decision of the couples whether to do or not to go ahead with the test. So we here offer NIPT as a screening test to all the pregnant ladies. The second category in whom it can be beneficial is the one who are undergoing an IVF pregnancy. Could be a egg donation or a surrogacy. So IVF pregnancies should be offered NIPT as the screening method of choice. Then we can also, singleton pregnancies is the best choice. Even in twins we can offer NIPT, but there will be a little changes in the results that we can, the clinician is a better person for the discussion. And any high risk pregnancies by the scan, if the early pregnancy screening scans, if they are suggestive of high risk, then those women should be offered NIPT as a screening method before subjecting them to invasive tests. Okay, you get NIPT test done, and there are two scenarios. One is the test can either come as negative or the test can come as positive. If the test is negative, no additional or no further test required for the chromosomal abnormality testing. Except for the routine 5th month anomaly scan, the rest can be done. Supposing the test comes as positive, what next? So if the test comes as positive, understand that it is not a confirmatory test, it is still a screening test, and that has to be confirmed by additional tests like chorionic villus sampling or amniocentesis. Those are invasive tests, and we also offer them a geneticist opinion and a maternal fetal medicine specialist opinion. So the take home message is, if the test is positive, you would still require additional tests for confirmation, and if the test is negative, all good, you are good, the baby is good. So no worries about it. In NIPT, we take the mother's blood. Since the mother's blood is taken, there is no damage or no harm to the ongoing pregnancy or to the fetus or to the mother. So it's a completely safe procedure with procedure related risks being negligible, compared to the invasive tests in which the tests, they themselves carry a procedure related risk of miscarriage. In NIPT, there is no such risks. How accurate are the results of NIPT test? NIPT has got a very high sensitivity and a specificity rate, that is 99%. But there are certain things that can affect the false positive and false negative results of the test. The factors that can give false positive values or false positive results are, one is confined placental mosaicism, in which only the placental cells will have an abnormality, but the fetus proper will not have any test. Such cases there can be a false positive, but the fetus will be fine. The second one is maternal copy number variations, in which there are duplications, deletions of the maternal blood cells that can also affect the positivity rate of the tests. The third thing that can affect the positive values of the test is, which can give a false positive results, are if the mother has got malignancies. In such cases, there will be some genetic abnormalities in the cells that can interfere with the results of the NIPT. And the last condition that can affect the accuracy of the test is vanishing twins. The genetic component of the vanishing twin affects the results of the NIPT. What are the factors that causes false negative tests? That means that the test is negative, but in fact the fetus can be affected. Such cases, the examples would be if the test is done very early in pregnancy, like when it is done around some 2nd month or something, in which the fetal fraction, that is the amount of the fetal cells that we take, if it is very less than 4%, then the accuracy of the test is not that good. The other condition is when there is maternal obesity and high BMI. If the lady is obese, the accuracy of the test comes down. And patients with autoimmune diseases, examples could be SLE, rheumatoid arthritis, those conditions also, there can be a false negative results. So once we take the maternal blood, we try to separate the cell-free DNA in that. That means that the cell-free DNA is the fetal blood cells or the fetal DNA, and the minimum required fetal DNA fraction is 4%, because the accuracy of the test depends on the number of the fetal DNAs that we study, and so the minimum required is 4%, and a good number could be somewhere around 10% is the expected fetal fractions in the mother. So out of that, we take the cells, we do the genetic testing, and then the reports are given. So NIPT is a reliable and a reasonably accurate test for the screening of genetic aneuploidies. Lupin Diagnostics, which carries out the NIPT test, is registered under the PCPNDT Act by the law of India to carry out the NIPT and the genetic aneuploidy testing. So, a test requisition form, that is TRF, is handed out to the patient, where they have to fill all the details, and then the sample is taken and it is sent to the laboratory. So, at Lupin, they do something called as next generation sequencing, which accurate detection of chromosomal aneuploidies based on comprehensive whole genome analysis. So, they do accurate results with sensitivity and specificity greater than 99% for the trisomy 18, 21 and 13, and a comprehensive turnaround time of 10 to 12 days for the reports, and pre and post genetic counseling is offered to the couples. The reports will be dispatched to the obstetrician and they have to hand it over to the patient.
Thank you.